The World Health Organization is due to hold another emergency meeting tomorrow to decide whether to declare monkeypox a global health emergency. Yesterday, the UN agency recently reported that there are now more than 9,000 monkeypox cases across 63 countries. For more on this, let's speak to infectious diseases specialist Jeremy Nel. Jeremy, a very good afternoon to you. Welcome to Daytime Update. So another meeting due in the next 24 hours to decide whether monkeypox should be declared a global health emergency. Is this the time for that declaration when you look at just the number of cases confirmed so far?
Yeah, I think the number of cases now is up even over 14,000, and it's the declaration by the WHO is really it's their highest level of alert for these outbreaks, and really it's more about setting in process a set of coordinated activities rather than any sort of indication that this is any reason to panic or anything like this. I think we have a good handle on where the epidemic is going currently. But it's really from a WHO side about whether they want to up level, if you like, the amount of concern and resources they develop and throw at the problem.
And just on that point, how much would a declaration help in terms of the global response to monkeypox?
Well, I think it helps raise awareness, but there's also other mechanisms that the WHO can link into at that level. For example, when they do throw more resources, more people, it's also it highlights the need to work together for countries to make sure that there's a coordinated global response rather than something localized at a sort of at individual country level. So I do think it would help if that's where they think it's needed, but that of course will be their decision tomorrow. But I think regardless, the situation on the ground won't change much in the immediate term.
So the concern about monkeypox, it's not a new illness. It has countries where it's endemic. We're worried, worth repeating, because we're now seeing a spread outside the endemic region, mainly in a specific region of Africa, right? But when you look at the cases, still fewer than 20,000, at least as far as what's been confirmed. Does the level of alarm and conversation match the spread?
Yeah, so this epidemic is mostly centered in Europe and America predominantly. There have been only 3 cases in South Africa and a smattering throughout Africa in this epidemic. It's certainly important to be concerned and to be aware of it, and I think the general population is. But I do think it's important, we've just come out of a pandemic from COVID, which is very, very different. And it's very important that we understand that this is quite different. The chances of a widespread epidemic going through the general population are pretty low still. This is being spread by close contact. This is particularly in this epidemic through sexual contact. But it's really about close contact, either face-to-face or sexually, and particularly within sexual networks at the moment. But it's really not a widespread problem. I mean, it sounds like a lot of cases, but when you look at them globally, it's not causing significant disruption in any particular country. So it's something to be aware of, but not to panic about, certainly.
And there's also been a great deal of worry about the messaging from the World Health Organization in South Africa. There was also a lot of criticism when the likes of Minister Joe Phatla held the briefing and said, well, monkeypox at this point was spreading, and I'm paraphrasing, of course, they went with the line that it was spreading among men who have sex with men or gay men, and that has been criticized as, in fact, being counterproductive and possibly fueling stigma.
Sure. I think it's a very important thing to be aware of, and certainly you wouldn't want to feel stigma in the slightest. It really is spreading along predominantly at the moment, men who have sex with men, and that is true. But I think the way to do that is to make people aware, particularly if you are in that community, that this is something to be aware of at the moment, but certainly not to feel stigma about this. This is just, it could have happened to any group. As it turns out, it happened to, predominantly one particular group, but that's not limited to that group. It will spread in the general population if it hangs around much longer. And it's really something for everyone to take on board. Although I think the messaging to the MSM community would be, that this is something which they particularly at the moment need to be aware of. And if that changes, of course, we'll update the information.
What are the chances of monkeypox spreading undetected? And I asked this at the beginning of these conversations now a month and a half ago, because when you consider the list of symptoms, you could think that you're coming down with a long list of other illnesses, really.
Sure. It certainly can spread undetected, and it has, in fact. I mean, the cases that we've diagnosed in South Africa, 2 of the 3 had no travel history, which means that there definitely are other cases because they got it from somebody else locally. So it definitely has spread undetected, and probably for a lot longer than people have realized. Most of the symptoms in the beginning are pretty non-specific. They're quite flu-like. get fever, chills, headache, muscle aches, those sort of things. And it's only when a rash develops that people start thinking specifically about whether this could be monkeypox. So, the good news in some ways is that almost all of the cases do have a rash. And that's really the key thing. I certainly wouldn't want anyone with a headache or fever wondering if they've got monkeypox at this point. But it certainly does spread undetected in some cases, although, once the rash occurs, then it's usually a bit easier to diagnose.
And by the time you developed the rash, am I right to say that you would have been ill for quite a few days before that, likely?
Yeah, the average is about 2 days or so between when you start to feel sick and when the rash starts. But that varies. I mean, it can be anything from the same day to a week or more later. But in general, you've been sick a couple of days, let's say, on average, before the rash starts, yeah.
And would any doctor whose office I walk into tomorrow, let's say, be able to immediately identify monkeypox, or do we need to go to specific people?
So the National Institute of Communicable Diseases, the NICD, does offer testing. Some of the private labs offer testing as well now. And really, so in other words, you don't have to go to specific places. Your general practitioner or family practitioner can do it, as can all the hospitals for the testing. As you can appreciate, the risk in South Africa is very small at the moment. We've only found 3 cases. I know there will be more than that out there, but it won't be thousands and thousands. So the risk to any individual is very, very low at the moment, and mostly it need reassurance. But if the rash does fit the bill, and if it looks like the clinical features fit monkeypox, it certainly can be tested for in South Africa from pretty much anywhere. Yeah.
Jeremy Nel, infectious diseases specialist. Good to have your time. Thank you.